Hi, how you doing? My name is Dr. Eric Miller. I'm with Chiro-Med Health and Wellness Centers located in Orland Park, Illinois. Today's topic is going to be about human intervertebral disc diseases. Let me have you scan into this model very quick. I want to get a definition about what the disc does, what its purpose is. When we look at the disc, what we see is a gelatinous center called the nucleus pulposus, as well as a cartilaginous fibroelastic layers that surround it to contain the jelly-like material inside. The purpose of this disc is to act as both a spacer and to add flexibility through the spinal column so that we can move with good flexibility. The disc needs that flexibility to actually get nutrition into the disc. The disc is a spacer for what's called the intervertebral foramen, which is the holes where the nerve comes out between each and every vertebrae. So they're very important. There are a few things that basically cause problems with discs. I mean, you've heard of disc bulges, disc prolapses, disc herniations, disc degeneration. These are the four things that generally happen to discs over time if there's problems with them. There are a few different ways to actually cause problems with the disc. One would be something traumatic, such as an accident, slip and fall, car accident, something that causes a shearing force through the disc. It's normally when the body's flexed and rotated when lifting something, or if you're in a car accident and your body goes forward, and it actually compresses the disc and spins it, and that creates a tear or fissure in the disc, and then that disc will herniate at that time. But the most common way that discs become pathologic is by abnormal stress, wear and tear over time. So what can actually cause that abnormal stress? The biggest cause of abnormal stress to a disc over time is misalignment. So when the vertebrae are misaligned, they're going to basically be putting abnormal stress through that disc over time, and that abnormal pressure is going to create cracks and fissures in the outer layers of the disc, and that jelly-filled center is eventually going to migrate towards the path of least resistance and create a bulge. Now I want to look at this MRI. So this is the same patient, and when we look at an MRI, basically what we want to see is nice white discs on this particular view, nice gray discs on this particular view. But what we want to see is that the discs are well hydrated. So discs need nutrition. The nutrition of the disc is made by a pumping motion via motion through the vertebrae. So if a vertebrae is misaligned or stuck, it can't move properly, the discs don't get their normal nutrition because they're not being fed through what's called a convection. So a disc that is healthy is going to serve its purpose as a spacer. It's going to allow plenty of space for the nerve to come out behind that particular vertebrae, and it's going to allow motion through the segments so that things can stay healthy and you can withstand stresses that are up to 10 times your normal body weight. If we look at this particular picture, you can see what a disc herniation looks like. We see that the disc is actually bulged backwards into the canal, and it's actually broken through the outer layers that are called the annulus fibrosus and into the canal. What happens when this particular situation occurs is that there can be pain in the spine. Disc problems cause a lot of spinal pain. And it can be neck, mid-back, low back, it doesn't matter what particular area, but the disc is innervated by a nerve called the sinovertebral nerve. It's pain sensitive, and you can have spinal pain just from disc pathology. But another thing that can happen is the disc can actually bulge and create pressure on a nerve that exits. I'm going to show you with this chart. If you have a nerve in the neck, that can actually, or a disc bulge in the neck, that can actually irritate a nerve going down the arm, or if you have a disc problem pinching a nerve in the lower back, it can actually create pain like sciatica going down the leg. There are different types of disc disease. There are different diagnoses. The first one is a disc bulge, which basically means that the jelly-filled material in the center of the disc is still contained within the outer layers. So you basically have the jelly-filled center, again, the nucleus that's contained within the outer layers. And it bulges outward, and again, that can be pain sensitive, but it can also be putting pressure on the nerve. The next thing would be a disc herniation. So when the jelly-filled center actually migrates through the outer layers and it produces a herniation, that material is now out of the area that it's supposed to be, and it can have a direct effect on the nerve. The body also perceives the disc material, the jelly-like material, the nucleus, as a foreign substance when it's herniated, and it creates an inflammatory reaction, and the body will actually lay down white blood cells, lymphocytes, macrophages that are part of the inflammatory cycle, and that in particular can also occupy space that can pinch the nerve. So it's good to get an anti-inflammatory effect in that particular area as soon as possible to take the pressure off the nerve, get rid of the inflammation as much as you can so that you can take the pressure off that nerve as quickly as possible. The longer that you have pressure on a nerve, the more likely it is that you're going to suffer consequences as sensory deficit or even motor problems like weakness in the legs or weakness in any particular muscle that that nerve happens to be connected to. And unfortunately, it takes a long time for that nerve health to come back, the nerve flow to come back once it's been pinched for a while. It takes a long time. In our office, we typically will treat for 2 weeks conservatively, just based off of our findings on x-ray. If you're not responding like you should, or if we're not decreasing either the spinal pain or the nerve pinch pain, then we send out for an MRI to see exactly what's going on with the discs, and based on what we see with that, we make our decisions. If you're suffering with any problems with spinal pain or nerve-related pain, such as numbness, tingling, weakness, give our office a call. We are located in Orland Park. Our phone number is 708-403-2727. Nice talking to you.